Friends, topic of today is respiratory viral infection, symptoms and remedies. Three common conditions are due to respiratory viral infection. They are common cold, influenza, which is also called flu in short, and third is COVID-19. All these conditions have similar symptoms and remedial measures, hence they are taken up together. Duration of disease in case of common cold and influenza is 7 to 10 days. In case of COVID-19, duration of disease is 2 weeks. But in case of severe infection, the disease may last up to 6 weeks. More than 200 different viruses are implicated in causing common cold. A few of them are rhinovirus, coronavirus, adenovirus, parainfluenza virus, respiratory syncytial virus, and enterovirus. Influenza is caused by influenza virus. COVID-19 is caused by a type of coronavirus called severe acute respiratory syndrome coronavirus 2, in short SARS-CoV-2 virus. Respiratory tract is divided into two parts: upper respiratory tract and lower respiratory tract. Upper respiratory tract consists of nasal passages, pharynx and larynx. Lower respiratory tract consists of trachea, bronchi, bronchiole and alveoli. Viral infection affects mucous membrane of respiratory tract by inflammation. Inflammation of nasal passage is called rhinitis. Presentation will be sneezing and running nose. Inflammation of pharynx is called pharyngitis. Presentation will be sore throat and cough. Inflammation of larynx is called laryngitis. Symptom will be hoarseness of voice and croup, that is barking cough in case of children. Inflammation of trachea is called tracheitis. Symptoms will be croup and cough. Inflammation of bronchi is called bronchitis and symptom will be cough. Inflammation of bronchiole is called bronchiolitis and the symptom will be wheeziness. Inflammation of alveoli is called alveolitis, and when the alveoli is filled with inflammatory fluid, it is called pneumonia and the symptom will be breathlessness. I have already explained these conditions. Sometimes mucous membrane of eye is involved, which is called conjunctivitis. Presentation will be red eye. These are the constitutional symptoms: fever, chills and shaking in case of influenza, headache, body ache, muscle ache, ear pain, fatigue, vomiting in case of children, and diarrhea in case of COVID-19. These are the emergency symptoms for which admission is required in hospital, like difficulty in breathing, chest pain, confusion, severe or persistent vomiting, sudden dizziness. These are the high risk population: children under age 5, adults older than 65, pregnant women, people with weakened immune response, or patients taking immunomodulating drugs, chronic illness such as asthma, heart disease, kidney disease, liver disease and diabetes, as well as obesity. Mostly diagnosis is clinical, but when lower respiratory tract is involved, PCR test is to be done, that is polymerase chain reaction. These are remedial measures: plenty of rest, drink plenty of fluids, preferably water, fruit juices, hot lemon and honey drink by adding 2 teaspoonfuls of honey in a glass of warm water. It will loosen mucus and make it easier to cough. Do not smoke. Gargling with warm saline water. Half teaspoonful salt is dissolved in 1 cup of water. Gargling twice a day. Drink hot tea to broth or chicken soup. Stay away from caffeinated drinks like soda and coffee. Eat a spoonful of honey. This has got a soothing effect in case of sore throat. Avoid alcohol, vaporizer or humidifier to ease congestion. Steam inhalation, mild exercise, sufficient sleep, fresh fruits and vegetables to boost immunity, regular meals, stay positive. Antibiotics have got no role on the viruses. Antibiotics should only be given in presence of superadded bacterial infection. For fever and pain, paracetamol may be given. Do not give aspirin to children under 16 as it may cause Reyes syndrome, which involves brain and liver. Decongestant and antihistaminics may be given. Antiviral drugs only by the advice of physician. Regarding prevention, viral transmission prevention protocols should be adopted like hand washing, use of mask and social distancing, yearly flu vaccination as the first and best way to prevent the flu, and COVID-19 vaccination. Thank you.